red handles that all pose a function. They all do movement of some kind. So with the handrails, when you push up and down, it makes it go down, pull back up. There's also a red handle underneath the stretcher that you can lower it and raise it by yourself with one person. Never do this with a patient. You can lower it and raise it and lock it by yourself. That mainly helps when you're putting it back in the truck. There's also a red handle underneath that lowers the back. You can lift the head. So if you need to get to a tight place, you can round corners a lot easier with this than if this is all up. And this goes also down. You also have locking mechanisms that are red. There we go. See, it locks the wheel. Only the front two wheels lock, the back ones don't. Also here, your handles, what makes it go up and down, they're also red. So anything that's red has movement. So if you touch it, make sure you know what it does before you do anything with the patient on there. You have a red lever here that can put the patient's legs up, and then you push it down, pull it up, and it makes it go up and lock in place. So as you lift up, you pull the handle, and then you can go down with the stretcher. Releasing the red handle releases the locking mechanism, and the stretcher will go wherever you release it at. And vice versa, going up, you squeeze it, lift it, let go, and then put it back down.
As you unload the cot, release it from the fastener and move it out of the ambulance using the lower grips whenever possible. That helps reduce back strain. When the safety hook stops your motion, the second operator guides the legs down to be sure that they're fully extended and locked. Release the safety bar and roll the cot away from the ambulance. A single operator can raise or lower an unoccupied cot by placing one foot on the base, parallel to the tube and away from the pinch point area. Lift the cot slightly to take pressure off the height adjustment mechanism. Squeeze the red release lever and raise or lower the cot. To raise or lower an occupied cot, lift the litter frame just enough to take pressure off the height adjustment mechanism. Squeeze the release handle and raise or lower the cot to the desired height. And keep in mind, good safety practices require that you use two operators to load the cot with a patient. Approach the back of the ambulance squarely. Move the safety bar over the safety hook, then back against the safety hook to raise the legs without hitting the bumper. Lift the cot and squeeze the release handle. As the second operator raises the legs using the side rail for stability and leverage and helps to guide the cot into the ambulance. To unload the cot with a patient, again, good safety practices call for two operators. Release the cot from the fastener, guide the cot out using the lower grips to help reduce back strain. When the safety hook engages the safety bar, the second operator guides the legs down to make sure that they're fully extended and locked. Disengage the safety bar and move the cot away from the ambulance. To lower the cot with the head section broken down, the head end operator, using the optional base lift bar, and the foot end operator lift the cot slightly. The foot end operator squeezes the height adjustment release handle, and they lower the cot to the desired height. Stay above the fifth height position. That prevents the head section from coming to rest in the casters. One operator can load the MX Pro without a patient. Just approach the back of the ambulance squarely, roll the safety bar over the safety hook, and then back against the hook to be sure the legs will clear the bumper. Lift the litter frame slightly, squeeze the height adjustment release handle, and lower the foot end to the ground. Then lift the cot to horizontal, roll it into the ambulance, and engage the cot fastener. Reverse the procedure to unload an unoccupied cot with one operator. Release the cot fastener, roll the cot out of the ambulance until the safety bar engages the safety hook. Lower the foot end to the ground, squeeze the release handle, and raise the cot until the legs are fully extended and locked.
On the stretcher. Hold on, I'm not ready.
Okay.
Can we redo that? I'm not used to it being on that side. Can we get a different stretcher?
Okay, good.
I don't. That's gonna be a terrible video.
That's gonna be a terrible video.